Welcome to Cancer Explained with Central Care Cancer Center. It's likely that someone you know has been diagnosed with a form of cancer. Learn more about specific cancers, their risks, signs, symptoms, and treatment options by listening to Cancer Explained.
Hello and welcome to Cancer Explained with Central Care Cancer Center. My name is Leanne Powers. I'm the Public Relations Manager for Central Care Cancer Center, and with me today is radiation oncologist Dr. Perez-Tamayo. At Central Care Cancer Center, we are dedicated to keeping expert cancer care close to home. We have state-of-the-art facilities throughout rural Kansas and in Missouri. Whether you need radiation or chemotherapy, access to clinical trials and novel treatments, financial counseling, or other supportive services for yourself or your family, Central Care Cancer Center is here for you. You have a choice. At any time, you can feel free to email with any questions or comments to askdoctor@cccancer.com. That's Ask Doctor, DOCTOR, at cccancer.com. Our discussion today centers around bladder, kidney, and testicular cancers. So I thought we would start with actually the bladder. It's pretty obvious, I know. We store urine, right?
Yes, the bladder is a storage, but also the last of our possible recovery of water.
Okay.
So it is a storage tank, but it also is a way of absorbing the water. If we are very dehydrated, it will do that. However, because it is a storage container, and it is also the end of the kidney drainage, so we're draining urine from the kidney, it does sit with a lot of potentially toxic elements.
Okay.
So if you are around insecticides, herbicides, anything that could be toxic, including things that go through your lung like smoke, it will end up in the bladder and it will stay there, causing irritation and potential harm to the lining, which is what causes cancer. It is the lining that goes bad.
It's the lining of the bladder.
The lining of the bladder. There's other parts of the bladder that can actually become cancerous, the muscle, for instance. There's other cancers of the bladder that are not native to the bladder but can start in the bladder, like melanomas, which are usually skin cancers. There's other cancers like lymphomas that are cancers of the lymph nodes, but they can also start in the bladder. But for the most part, bladder cancer is cancer of the lining, and that is the most common cancer of that particular organ.
Now, is bladder cancer pretty common among all the other cancers? I mean, I honestly don't hear too many.
It is quite common,
Okay.
but it is more common in other countries for various reasons. One is maybe because the incidence of smoking is higher, or eating smoked products, smoked meats, smoked, you name it. You can get the bladder to have these carboned elements in the bladder lining, causing cancer. But it also can be caused by certain parasites, schistosomes, that can cause the bladder to be irritated by these parasites that actually enter through your feet or bladder, or penis or urethra in bad water, and they can go into your bladder and cause irritation that way, causing a different type of lining cancer. It's a squamous usually instead of a transitional cell, but nonetheless a bladder cancer. Other cancers can be formulated in the bladder because of toxicity that you are absorbing through your skin, for instance, with insecticides and herbicides and anything that can, because your skin is like your mouth. That's why there are medications you have patches that you can put on your skin to absorb medication. People don't realize that your skin is actually like your mouth, you're eating it, but through your skin. So that goes directly to your kidneys. Your kidneys metabolize it or spill it out because it doesn't like it. It's a toxic element, and then it goes into your bladder.
Okay. And so if you have or been diagnosed with bladder cancer, could that cancer spread to other organs? Or?
Oh, yes. Cancer of the bladder usually does not spread directly, and that's why it's so curable. Usually if you can get it when it's just at the early stages, in other words, when it started in the lining. Now, the lining of the bladder is usually formed of, there's glands there. Glands meaning like your salivary glands, those are glands, okay? So they produce a substance or they absorb a substance. So these glands, when they get irritated, start having atypical cells in them, which actually you can pick up with a simple urine analysis. You can pick up these abnormal cells and diagnose cancer of the bladder. So it doesn't usually get to the point where it spreads. If you ignore it, it will spread. And it usually spreads locally to the muscle, to the lining, to then outside into the rectum or the bowel or anything around the bladder. Or it will go up into the ureters, which are what drains the kidneys, or down into the urethra, which drains the bladder. But then it can go into the blood because the bladder is very, very rich in blood vessels. So, of course, a little bit of cancer can directly go into the bloodstream, and then it can hit many things like your liver, your lung, your bones, your brain even. But it usually is either something that was born wild, because these cancers can be very, very wild just because of their initial nature, or it's because you've left them there for quite a while and it's gotten the chance to go into the bloodstream.
So I'm always told to drink, I don't know how many gallons of water a day.
No, you can die. You can die with water poisoning. No.
Okay, so I'm always told to drink lots of water throughout the day.
Yes. 36 ounces is good.
Okay, so flushing out my kidneys as well as my bladder, or
yes,
is that
yes,
to kind of
true.
reduce? Okay,
it is true that drinking water is going to flush things out of your system, and especially urinating. Often people retain the urine because it's not convenient to urinate because they're in a car or whatever. That is where you get the toxicity. Urinating frequently is a good idea. And when you urinate, for all the people above 30 years of age, and I say 30 because truly it starts there, your muscles become lax. And so stopping and going when you're urinating, stop, go, will actually get those muscles nice and tight. So you don't dribble when you're when you're older. So that's a good exercise. So if you do it often, you will also get rid of the toxic elements.
What about urinary tract infections or anything like that? Is that a symptom or a risk that if you have multiple UTIs then?
Well, that's a controversial subject. Some people feel that if you have multiple infections that you can get bladder cancer. It hasn't panned out. But the reality is if you have multiple infections of the bladder, especially if you're a man, it's for some reason. And usually it's because your bladder has been blocked by your prostate, or because there is something going on further downstream in your penis, or the opening of your penis, or the actual outflow tract of that area, or you have kidney stones that go down, or there are bladder stones. There's actually bladder stones. But it is sometimes due, and most of the time for both men and women, is due to technique on how you clean yourself after a bowel movement or just in general. Now, with this, now the new history of the HPV virus, the human papillomavirus, is now playing a role in also bladder cancer. It is not as common, but it can do that. When you have the papillomavirus in the general area, because it is usually a sexually transmitted virus, it can go up and it can involve the bladder, and you can get bladder cancer due to that. So washing your hands is an excellent idea. Most women will do that. I'm not going to say that most men won't, but this, urinating and shaking is not enough. You need to go ahead and wash your hands. But bladder infections are for the most part due to actually stool. The stool has E. coli, which is a negative cocci bacteria that goes retrograde into the urethra, which is what drains your bladder, and then it infects your bladder. People that are in the cattle business, and here for cancers, this is important because the cattle, many are not organically raised, and they are given antibiotics, and some of this E. coli that you actually are ingesting as well are resistant to many antibiotics. So be very, very careful, because here again, now we're getting into bladder infections that are not, treatable with antibiotics. But for the most part, this does not cause bladder cancer.
Okay. As far as symptoms go and screening options for bladder cancer?
Well, unless you had a very direct family history of bladder cancer, which is usually not familial, there is really no screening except the urinary analysis. If the urine analysis shows blood, for whatever reason, whether this is due to a bladder infection or due to a cancer, it needs to be further investigated. In men, it is always abnormal. Please note this. You have no idea how many times I see people that have had blood in the urine for years and nobody has said anything. In men, always it is abnormal and needs to be further investigated. And it's very simple. You just need to do some cytology in the urine or even a cystoscopy, which is relatively painless, and look around. And sometimes just a little scrape of the cancer is enough to cure it. So why even go there? So if you have something early, a simple procedure can actually cure it.
And so bladder cancer definitely is more treatable and curable than not.
Absolutely. It's when it becomes muscle invading, meaning that it's been there for a while, then you have to remove the bladder. You have to maybe give chemo or radiation. And why do that? You can avoid that simply by just getting it early.
Again, I'm with radiation oncologist and president of Central Care Cancer Center, Dr. Perez-Tamayo. We've been talking about bladder cancer. Again, you can always email your questions to askdoctor@cccancer.com. Okay, doctor. So now let's dive into kidney cancer. And correct me if I'm wrong, but I thought you had told me once that, kidney cancer was known as like a silent killer of sorts.
Yes, and it is known for a good reason, is that by the time that you have symptoms, it is already advanced. Usually, unfortunately, unlike bladder cancer that can easily be treated with very simple procedure, and it usually lets you know early on that there is something not right because the bleeding occurs very early, and in the case of renal cancer, that's not what happens. Although again, blood in the urine, that is a way of noting that something isn't right, is abnormal no matter what. So if you're already having pain in your flank, and you need to understand where the kidneys are. The kidneys are not, I'm surprised at how much we really don't think about the kidneys. The kidneys are not like in your abdomen somewhere floating around. They're actually pretty, in the very back of your body. They are protected very, very well because they're so important to our livelihood that they have a protective fibrous sheet on top of them, and they are what we call retroperitoneal. Peritoneum is basically the abdominal sac that all our guts are in. These are behind that. So if you can imagine a big balloon holding all our guts, well, these are behind that balloon, and they are protected by a fibrous sheet. Now, so when you have a reason to have a kidney surgery, they have to go from your back or your side to be able to get to them because they are so posterior. And they are so protected that you don't really know anything is going on because there's nothing there that is going to, alert us that there is something wrong until they start getting outside the kidney and causing stretching. Stretching is what causes the pain. Stretching of the capsule of the kidney or the surrounding area. And by the time that is the case, usually we're looking at a minimum stage 3 cancer. So again, if you have a family history of cancer of this type, although it's not usually familial, there's some very, very vague association with smoking, obesity, and high blood pressure, but again, not much. There are some agents, some organic solvents that are associated with renal cancer, and that's what we call kidney cancer, renal cancer. But it's not that common, and I hear a lot of people saying, "What about if I take Tylenol?"
Yeah.
Or I take Tylenol. Actually, is toxic to your liver more than to your kidney. But there are some things that are toxic to your kidneys. Many things in many antibiotics. So you really do need to protect your kidneys, but they don't cause cancer. They may cause your kidneys not to work, which is not good. Your kidneys' functions is to take toxicity. Is basically like your liver is actually removing toxic substance from your blood. It's a very, very highly rich in blood organ, and all the blood flows through there, cleansing it. it's a very important part of your body to be able to keep toxicity from, accumulating. That's why if people that don't have kidneys, they need to have dialysis, and that dialysis is what it's doing. It's doing the job of the kidney, cleansing your blood of these toxic substances.
What if you have, kidney failure or or kidney stones or something like that? Would you be maybe at higher risk for kidney cancer?
There's a little more association with kidney stones, but they're not kidney. It's not really cancer of the kidney proper. In other words, the parenchyma or the substance of the kidney, but of the collecting system. Kidney stones form in the collecting system. In other words, if you can imagine a river, the delta of the river, or where the river maybe ends up in the ocean, that would be the calyx seal, or the area where the outflow basically of all the different lobules of the kidney come out into the ureter, which is what drains your kidney down to your bladder. So that area can start accumulating substances like calcium and then start forming stones. So you can imagine, as a farmer, you know very well that this can happen if you're in a flood zone. As the water recedes, it leaves a film, and this film in the kidney case, especially if you're one that doesn't drink a lot of water, starts accumulating layer by layer until you have a stone. So the stones can be formed by many things, calcium and cholesterol and other things. You may be predisposed to that as a family trait, but they irritate and can form a cancer of the collecting system, which is completely different than the ones of the kidney proper, which is it's more of a filtration of your blood, and this is a different cancer altogether.
As far as any screening options, again, just probably the urine sample and such?
Yep, unfortunately not. And even the urine sample is minimally effective. And if you have blood already in the urine, it's usually advanced even then. And again, for the people that do have children with renal cancer, which is a different disease altogether, it is highly sensitive to touch. In fact, in some of those cancers in the world of the pediatric kidney cancer, if you touch them, they will actually spread. So you are very careful about smashing, or deeply palpating a known cancer of this area. They are very, very bloody as well. They can easily bleed, and sometimes that's what causes the pain. They start running out of blood supply because they're dividing so quickly, and then you get necrosis and you get pain.
As far as who has kidney cancer, is it more common among men or women or older generation?
It is twice as common in men for reasons that, are unknown. Again, you can theorize that water intake is less in men. Certainly, drinking water is going to get rid of toxicity from it's not maybe get rid of it, it's diluting the toxic elements and then causing it to just go away. And again, urinating often is a good thing.
All right, very good. I'm Leanne Powers, again with Dr. Perez-Tamayo from Central Care Cancer Center. We've been talking about bladder and kidney cancers, and now we want to talk about testicular cancers. Now, I understand, but for my health class anyway, most of the cancers of the testicle starts in the cells, correct?
Well, there are different cells in the testicle and this is important because a mass in the testicle, depending on your age, can mean many things. If you're an older man, for instance, let's say you're 50 to 60 and you have a mass in the testicle, it usually is not testicular cancer, but lymphoma, and a very mean lymphoma at that. So a mass in the testicle does not necessarily mean that it is a cancer of the germ cell or non-germ cells of the testicle. And, to know what the testicle does, is important because it does produce the sperm. And there are many parts of the histology from the moment you make the sperm to the semen, which is a different. People don't understand the difference. There's lots of parts that go into the semen, but the germ cell of the testicle, and the non-seminomatous are usually seminomas, and the seminomatous cancers have a very different way of treating and actually different survival. But for the most part, any cancer of the testicle proper is highly curable in the 90th percentile.
Oh, that's good.
Yes, and the most common is the most common solid malignancy in males from ages 15 to 35. There's a high family history. Usually there's a propensity. There's also a high incidence depending on the heat the testicle has received as a child. That is why when you take your child to a wellness checkup, they feel the testicles, because if you have testicles that have not descended, we call it cryptorchism, those testicles can become malignant in the later years because their body temperature is too high. That's why the testicles are outside the body. They need to be at a lower temperature than your body. So people using tight-fitting, as it was in one time in the 70s, very popular, used the jeans that were so tight, you even would go into a bathtub to get them tighter so the water would make them shrink. This is not good for men. You have a propensity to get cancer, and in fact, there are some genetic conditions that you may have the testicles inside your body. Even women could have testicles, and these testicles need to be removed because they will become bad.
Symptoms of testicular cancer? Is there?
Usually none. Okay. Usually what the symptom is that you have a mass that is growing.
And you can feel that mass.
And you can feel it, and you can quickly get rid of it. And as you know, there are some very famous sports people that have gotten testicular cancer, and usually they are bicyclists because, again, the suit is very tight on the body, and they are also being pressed against the body, and this makes them higher incidence of cancer of the testicle. But even if it goes into your brain, it is still highly curable.
So testicular cancer could spread?
Oh, it is often it spreads. It spreads very often to the lymph nodes. Okay. You need to understand that the embryonic development of the testicles. The testicles start in the kidneys. They start in the kidneys when you're developing in utero, and then they go down. They form their own vessels, and they go down into the scrotum as the child matures inside the body. So it is this spread. This is how it spreads. In an adult pediatric population or adult male, it spreads into the direction. The first line of spread is actually around the kidney because that's where it started. So it often spreads to the lymph nodes, but even then, highly curable. So it is important to pick it up at any point, but hopefully the sooner the better.
Again, regular self-examination and also have your regular checkup, I assume, in order to determine if there's any symptoms or risks?
Yes, that would be the best. Feeling your testicles from time to time, just like a breast exam, is a good idea. And as I said, even in older males, testicular cancers that are not primarily testicular, but lymphomas, for instance, the sooner the better. So to do an exam is better. Now, you can find abnormalities that are not cancer, okay? The testicles can have little bumps that are not necessarily they're part of the anatomy, or there's other issues, but not cancer. But if you have something, it's easy to detect. Then there's some blood markers that can tell us primarily what kind of cancer, if it's a seminoma versus a non-seminomatous tumor. And imaging also right away, which is an ultrasound, usually tells us if it's a solid mass. Usually these are solid. Unlike, especially in older males, you can have what we call seals, which are these cystic structures, and they're not cancerous. They're just abnormalities that occur with time.
So again, the symptoms usually just a lump, but would it be on both or just usually one?
Well, that's a very good question, because once you have one, you can have another. Obviously, whatever happened to one testicle happened to the other. So if it was due to a heating situation as a child, you probably had both testicles in the same. So it is important to talk about, the ramifications of that. So if you have one cancer, you are most likely to have another one. Your risks are increased dramatically. And therefore, it is important if you want to have children to think about sperm banking, because the possibility that you may have another one in the future is high.
And then what about even treatment then for testicular cancer? Is it primarily like radiation, or depending on, again, on what stage you're at there?
Well, there's some very solid protocols for treatment depending on whether it's a seminoma or a non-seminomatous tumor. And there are some that are a little more controversial. For instance, in seminoma, the workup would include getting a blood test to see if it's a pure seminoma, because sometimes there's a mixture of seminoma and non-seminomatous tumor. So something called a beta-HCG is obtained, LDH, and alpha-fetoprotein. All of these are important blood tests to see. Now, if you have definitely gotten a seminomatous diagnosis, the first thing to do is to remove the testicle, and it's called a radical orchiectomy, or removal of the testicle. Now, interestingly, for people that are not familiar with what that means, it doesn't mean that you cut the scrotum and you take the testicle out. That would mean that you could contaminate the scrotum with cancer. So you don't do that. You actually get an inguinal, or your groin, in your groin area. There is a way of delivering, we call it delivering the testicle outside through the groin, and then you cut it there. And then you analyze it to see how big it is, whether it's involving the any of the tissues around that area, including the cord or the epididymis, which are parts of the testicle. And depending on that, you stage it. If it's a early stage, you may just need the surgery and nothing else. If it is not, then you may need something else. And see, here again, if it is early enough and there's no lymph nodes, then we talk about some of the controversial material, whether you observe or do you treat the lymph nodes prophylactically, meaning before it happens. The treatment is very low with radiation, actually, very low, because this cancer is highly sensitive to the radiation, and it can easily be treated without much trouble. Now, the non-seminomatous tumors is another matter, and usually there is chemotherapy involved in this type of situation. If there's a lot of nerves if you do more surgery than just the testicular removal, you can get side effects that are not welcomed. For instance, you can get retrograde ejaculation, meaning that if you ejaculate, the ejaculate goes backwards into your bladder. So, that would be a problem if you want to have children. So many times there is, you can do something nurse sparing type of surgery, or just treat the areas prophylactically. Surveillance is still a part of the treatment, but chemotherapy also is something to do prophylactically. There's certain drugs that are used. I won't go over them because there's quite a few of them. And again, with the non-small cell, there is other things that you do that are prophylactic and also for treatment. And even, as I said, even if the cancer has gone elsewhere, it is highly sensitive to treatment, and so easily treated even if it's in the brain.
So, to recap, I think throughout our whole conversation today on bladder, kidney, and testicular cancer, drink your water, maybe have a urine sample to check to see if blood is in there, wash your hands, reduce the heat in and around your testicle area, as well as avoid the tight-fitting jeans.
For testicle, that's absolutely right. And of course, you have then the genetic situation that if you have those genetic abnormalities, then we're talking about other type of prophylactic treatments that you may want to do before you get a cancer.
Got it. All right. Thank you, Dr. Perez-Tamayo. Always so interesting, each topic. We appreciate you taking the time to listen to Cancer Explained with Central Care Cancer Center. With facilities throughout rural Kansas and in Missouri, Central Care Cancer Center offers complete cancer care all under one roof, so there's no need to travel far for the best in care. Whether you need radiation or chemotherapy, access to clinical trials and novel treatments, financial counseling, or even supportive services for yourself or your family, Central Care Cancer Center is here for you. You have a choice. Bringing expert care to you is an important component in the success of your outcome. Being surrounded by your family and friends, they can be the factor that elevates your treatment. Feel free to reach out to Central Care Cancer Center by calling 800-592-5110 or visit us online at cccancer.com. You can always send an email to askdoctor@cccancer.com. For Dr. Perez-Tamayo and all of our amazing providers and nurses, I'm Leanne Powers. Thank you for listening to Cancer Explained with Central Care Cancer Center.
You've been listening to Cancer Explained with Central Care Cancer Center, offering expert cancer care that's close to home. Central Care Cancer Center has clinics throughout Kansas and in Missouri. Central Care Cancer Center, online, cccancer.com.